Hi everyone, my name is Audrey. I am a first-year master's student in the computational science program, and today I will be talking about my project of modeling the spatiotemporal distribution of HIV infection in the brain. So this project is in collaboration with UC Davis and their Center for Immunology and Infectious Disease, where we used their data that they obtained on monkeys and their HIV viral load in different regions of the brain, as well as in the plasma or the blood, and the CSF or cerebral spinal fluid. And so in order to create our model, we use that experimental data to determine a correlation of different brain regions with the CSF in the plasma in order to assess the importance of even considering those different brain regions. And so looking at our graphs, we see there's not a high enough correlation of the CSFs or the plasma with any of the brain regions in order for either of those to accurately explain that viral persistence within the brain, meaning it is important to consider the brain. And so we move on to do a correlation network between each brain region in order to determine what compartments of the brain are most important to consider when creating our model. And so using the information from that graph, we determine that there are three essential compartments in the brain to consider, and this will be the prefrontal cortex, the primary visual cortex, and the choroid plexus. And so using that, we create this mathematical model in ordinary differential equations in order to explain that spatiotemporal distribution of the virus among those different regions of the brain. And so in order to make sure that our model is accurately representing what's going on in the brain, we plot our experimental data versus the model prediction. So we use the experimental data from UC Davis and the viral load that we obtain from our model when we run our simulation, and we find a slope of 1 when we do a best fit line, meaning that our mathematical model is accurately representing that experimental data and the viral load within the brain and the different regions of the brain. And so we also tracked the viral load of HIV infection among those three different regions over a 4-week period, and we see that the viral load differs among the three brain regions, just reiterating that it is important to consider different regions of the brain since that viral load is going to be different among all three. However, we don't know our parameters, so we perform a sensitivity analysis in order to look further into what parameters are influencing the output of our data. And we use a Latin hypercube sampling and partial rank correlation coefficients in order to do so. So we take a uniformly distributed range of values for our parameters based on past work and run our simulation about 1,000 times. And using the output generated from each run, we will use the partial rank correlation coefficients to measure the sensitivity between the model parameters and the viral load of HIV in different brain regions. And so looking at these graphs here, we see that our delta parameter has the most influence on the viral load in each of the three brain regions. And we also see that influence or sensitivity decrease each week or over time. And on the contrary, we see that alpha 1, 2, and 3 in all three outputs has little to no influence on the viral load in each of the three brain regions. So in conclusion, we analyzed experimental data and concluded that viral burden within the brain must be considered to accurately evaluate the HIV status of patients. And we use correlation network analysis to determine which regions specifically within the brain are most important to consider to explain that HIV status. And using that information, we created a new model to explain the spatiotemporal distribution of HIV infection in the brain and performed a sensitivity analysis to determine the influence and sensitivity of our parameters on the viral load in different brain regions. Future work, we may observe viral dynamics over a longer period of time since HIV is a lifelong diagnosis. And We hope to observe the reproduction number within different brain compartments and have that ready in time for the ACSESS event. And later on down the line, we'd like to include the influence of pharmacodynamics on the distribution of HIV infection in the brain, or more just look at how medication affects that distribution. Thank you.